not only that, the way it has seen us through this incredibly difficult and painful coronavirus pandemic. We are really grateful to you for joining us tonight. There can be no greater cause than the defence of the National Health Service, and we would love it if you could share this live stream, because you are about to hear people who really know what they're talking about on the health service and privatisation and the potential coming threats. So please, if you can, share this link. It has become even more relevant this week because Labour MPs put forward an amendment to the trade bill which would have protected our NHS from trade agreements, and some people talk about protected them from the UK's ability to control many elements of it. We also heard Donald Trump's comments, which he did roll back on, but they were there nevertheless, that everything with the trade deal is on the table. Good evening, Jeremy Corbyn. Thank you so much for joining us. Just before I do go to our first speaker, which is Jeremy Corbyn, I just actually want to say a few words on behalf of the People's Assembly to you, Jeremy. I know you're just kind of catching your breath there from a previous event. And that's to say solidarity to you, Jeremy, for all of the attacks this week. We are so grateful that you could join us tonight, and we know there are many people watching who also extend that unreserved solidarity to you in all of the things that have been thrown at you this week. We are going to be talking about the National Health Service, and we really do want you to stay around for the kind of end of this programme when you get your chance to have your say. Please put your questions in the comment and chat bar, and I will do my very best to read as many of them out. One announcement I've got before I come to Jeremy Corbyn, and the announcement is that this Saturday we have an event that we'd love you to join us for. It's called The Future of Industry, Jobs and Rights at Work, and there's going to be a link to that in the comment bar too. That starts at 1 o'clock on Saturday. We would also love it if you could donate to the People's Assembly, and how you can donate is also being put in the comments bar right now. So share this live. We're just about to come to Jeremy Corbyn. Good evening, Jeremy Corbyn. I don't know if you are ready to talk to me. You're ready to talk to us. If you could take yourself off mute, we are talking about the future of our National Health Service, and I'm just going to hand over. Are you okay there, Jeremy?
Yeah, fine.
It's lovely to see you. So I just want
to some better light. Hang on a minute.
No problem. I just want to hand over to you, Jeremy, to talk to us about, I suppose, what, is very topical at the moment, but what you see are the kind of threats to the National Health Service. I suppose in many ways you have been vindicated in the kind of holding up of that leaked report during the general election. You might want to reflect on that, and also talk to us a bit about how we are going to work together to be there in defence of the National Health Service. It is over to you.
Laura, thank you very much, and thanks for what you're doing tonight, but what you do at all the other times in opposing austerity and the economic thinking behind it. And there is a sort of sense, which I'll finish on as well, of disempowerment at the present time, that none of us have any power, none of us are capable of doing anything, and we're only spectators in a sort of dystopian destruction of our public services and everything else. We don't have to be. We can be very different. We can be very strong and very powerful. And I also want to just say personally, a huge thank you to thousands of people, and it is thousands, who've been in touch with me over not just over the past few days, but over the past few months, and given me some lovely letters and a lovely sense of solidarity by explaining their own lives and what they're doing in their own communities. And I feel very invigorated and very empowered by that. And there's a kind of perverse reaction that every time one of our mainstream media have a big time go at any of us, more people get in touch, more people get emboldened to do something and become active. And so in some ways, the best recruiting sergeant for activities of those who want a decent and better society is attacked by the Daily Mail, Daily Express, Daily Telegraph. And also, if I may say so, the cynicism of the supposedly liberal media actually is something that I find extremely irritating, because they could be playing such a more positive role in all of this. Now, take yourselves back a few months. Last year, we had endless debates in Parliament and in the Labour Party and in the unions about attitudes towards Brexit and the issues of future trade arrangements of this country. And we consistently said that the direction in which Boris Johnson would take us was one of a sweetheart trade arrangement with the United States. And that trade arrangement would include access to our public services and our National Health Service, the health market, as they chose to call it. And indeed, during his state visit, Donald Trump drew attention to all this and said a number of quite contradictory things, one of which was that healthcare was absolutely on the table and was part of the agenda on trade talks. Then another one saying it was nothing to do with the trade talks and he wasn't interested. They can't both be true. I suspect that they are on the table. They were being talked about, and I said so at the time. During the election campaign, we discovered a whole sheaf of documents. Indeed, I've got them all here still in this very room, of redacted resumes, or actually minutes, of talks that had gone on between representatives of the UK government and the US Department of Trade, in which they said in terms that there had to be, in any future trade agreement, a specific trade agreement between a non-EU Britain and the United States, there had to be access to our markets, our public service markets, National Health Service as well as local government. Some of you might remember, during one of the debates, I read those documents to the audience during the debate with Boris Johnson. And I said to Boris Johnson, well, what's your answer to that? And his answer was, get Brexit done, which isn't really an answer at all, because it did not answer the points. And then said the NHS was, of course, safe in his hands. Everything I said, I believe to be absolutely true. They are on the table, they are under discussion, they are under debate, and they remain on the table under discussion and under debate. And so when the Russia report came out last week, I was attacked as though I was super sympathetic to Russia because they claimed the documents had been achieved from Russian sources. Well, I'm actually more interested in the contents of the documents than whatever the source was. I got the documents. Nobody has denied their veracity. Nobody has denied the contents of them. That is the essential point. And so we have got to work on the assumption that in addition to the dangers to our National Health Service and the Health and Social Care Act of the coalition government, we have the additional danger of the Trump trade deal and the right, as they would term it, of US healthcare companies to bid for and run our NHS, even worse than is at the present time. I'll give an example from a local hospital, my own local hospital. They are under a PFI for part of the building, which is quite expensive. It's possibly not the most expensive PFI I've ever heard of, but nevertheless, it is a private finance initiative. It does take precedence over all other spending. They then had a plan to outsource the management of a lot of non-hospital site buildings that in the community that the hospital owns and uses for community services. And I've no problem with these buildings outside the hospital. I welcome the community services that they operate from them. They were proposing to hand the whole lot over to a private company to run them and to redevelop them and so on. And a number of us, the local MPs, all the local MPs, Catherine West, Emily Thornberry, myself, very strongly opposed this. And eventually the hospital changed its mind and decided not to go ahead and to go for an in-house solution, which I was happy with. And I said, go ahead with the in-house solution and talk to us about how you're going to do it. Absolutely fine. Next thing we find is my hospital faces a legal challenge of many millions of pounds in order to pay for a contract the company didn't get. The company didn't get, and this was a derivative of the company that did the work on Grenfell Tower. That is the danger to our NHS, the right of the private sector to take away from it. So I just say this: our NHS is under threat from health and social care. It's under threat from the trade deal that's being negotiated with the USA. And whilst the NHS staff, all staff, cleaners, porters, doctors, nurses, consultants, administrators, managers, security, have worked heroically during the corona crisis, the government's response has actually been to hand over an awful lot of stuff to the private sector. There's been privatization before our very eyes during the corona crisis. Our demand has got to be the simple one. It's our NHS. It's not for sale. It's got to be all publicly owned, publicly financed, and publicly run. And you know what? Public finance through traditional public sector borrowing through bonds is the cheapest way of investing putting capital investment into public services. The most expensive way is to hand the hospital over to somebody else, or to borrow money through a private company to run a part of the hospital. And so let's stand together for an NHS that's totally publicly owned, a care service that is publicly owned and publicly run, and be strong. Be strong. And I say this in the last half minute. When we're strong, we're powerful. When we're powerful, we're together. We're together for our NHS. We're together for a Green New Deal. We're together to oppose austerity and the job cuts that are coming at the end of COVID. That is what makes us different. Our strength together. We win one battle, every other battle becomes another possible victory. Solidarity to everyone on this call. And thank you, Laura, for all you do, all you say, and the huge energy and enthusiasm you put into it all.
Thank you so much, Jeremy. Please don't go anywhere just yet. I just need to tell you a few things people are saying about you, actually. They're saying, I really hope Jeremy realizes, this is Michelle, how many of us are right behind you, offering support. Just so much love and solidarity for Jeremy. Mandy says, most honest man in politics. Huge respect, Jeremy, or respect, Jeremy. So many people are sending their solidarity, Jeremy. Like, we know what you did, and I know you said the line quite flippantly, really, in your contribution there. You said that you meant every single thing, and you believed every single thing that you said in that general election campaign. And you are a very, very honest person. Sometimes it's hard to tell the truth in this political system. So thank you so much for doing that. Can I ask you one question that somebody has sent in? They said they just asked a simple question. This is Julie. Is it too late to save the NHS?
No, it's not too late, and we can save the NHS. You think of all the campaigns all around the country where A&Es have been threatened, where maternity wards have been threatened, where reorganisation has taken place, all these kind of things, and local campaigns get together, the hospital community, local communities, and they beat them off and they win. And so it is a question of solidarity between the workers, their unions in the hospital or whatever building it is that's affected, with the local community. But I'd also very strongly make the point that social care has performed heroically and suffered the most during the corona crisis. And there is every case for all social care to come back into the public sector, so that we have the security of knowing that those that we love are looked after properly in social care, and that care workers get properly paid. Because at the moment, some of the most skilled people I know are care workers caring for people sometimes who are suffering with dementia, profound disabilities, great difficulties, and very, very skilled people. And they're on the minimum wage. They should be treated with respect and given the support and training that they need to do their jobs. And that has to be right. And so I say thank you for all the messages of support and solidarity. I'm absolutely fine The people that are really suffering. Oh, I'm fine. I'm absolutely fine.
I know, but you're always fine. It's so interesting that there's all these attacks and you are fine.
But I tell you what, I obviously know and love the community I represent very, very well, and I learn a great deal from them. And there's people going through far worse things than, I mean, I just get a bit of stick from the media. They have trouble getting food on the table every week. That's hard. That's really tough. And so our community solidarity will build for the victories of the future.
Yeah. Jeremy, thank you so much. I know you're not able to stay with us.
The reason is I've got a local meeting of the private rented sector tenants this evening. We have 1/3 of my constituency are living in the private rented sector and paying incredibly high rents with obviously very little security. We have a local authority that is doing its best to regulate the private rented sector, but I want to go a lot further and obviously work with the local community on that. So we've got a meeting that's been set up from a while, and I'm very happy to take part in it with them. So thank you, Laura, very much indeed.
Honestly, Jeremy, thank you. So, of course we will. Robert says history will judge Mr. Corbyn kindly, and I agree very much with that sentiment. We're going to hear from Ellen Lees now. You're from the We Own It campaign. We are so interested to hear what you've got to say about this week's events and the campaigns that you're running. So over to you.
Thanks so much, Laura, and thank you everyone for having me. It's really, really great to be here. My name's Ellen, and I'm a campaigns officer with We Own It. We're a campaign for public ownership of public services. And for the last 9 months, I've spent the last 9 months or so being told by Tories that the idea that the NHS is about to be sold off in a trade deal is complete nonsense. So often and so persistently that at times I've started to doubt it myself, even though I even know exactly what the dangers are. And there's been a lot of mudslinging back and forth, and the rhetoric around this issue, especially around election time last year, is so fast paced, and I think a lot of nuance is lost in that. And this week, after the trade bill came back to Parliament for the report stage debate, and the Conservatives voted down an amendment that would have protected the NHS from trade deals, that sort of mudslinging and denial has kicked up a notch. So we've had a tweet from Liz Truss this week repeating that same lie that the NHS is not on the table. And even the Department for International Trade, supposedly a civil service department that's not supposed to get involved in politics, has been tweeting at We Own It on Twitter with a graphic that says the NHS is not for sale and never will be. They've since put out a little video, and apparently they're hiring a new media manager who's supposed to be in charge of dealing with fake news around trade deals. So apart from the slightly sinister connotations of a civil service Twitter account posting misleading graphics, it's really clear that the rhetoric around the NHS and trade deals is just really unclear, and it's not making sense to a lot of people. So I just want to try and explain a little bit and figure out what we mean by for sale and what the dangers are for the NHS in trade deals. So we're not necessarily looking at the entirety of the NHS being sold wholesale to Donald Trump or one of his private healthcare mates. And we're not necessarily looking at an insurance-style system, despite the best efforts of our friends at the Institute of Economic Affairs. But we are looking at the steady erosion of our NHS through privatisation, corporate control, fragmentation, and it's already started. One of the main reasons that I don't believe Tory MPs when they tell me they won't let the NHS be sold off in a trade deal is that they also tell me in the same breath that the NHS is not being privatised. Private companies already have a huge hold over our NHS, as I'm sure you all know, not just in clinical services, but things like operations management, IT systems, cleaning services, all sorts of things. And we've all heard the story of Richard Branson's Virgin Care suing the NHS after he lost out on a contract. They felt like they'd been unfairly treated, and they demanded compensation from our publicly funded health service. That's the level of entitlement that private companies have over our healthcare service at the moment. So when the US, in their negotiation objectives that were uncovered last year, say that they want to lock in current market access to the NHS, That's what they're talking about. Corporations have access to basically the whole of the NHS through this competitive tendering system. And locking in that access means that the US wants to make it impossible for us to reduce the access private companies have to the NHS, or in other words, to reinstate our NHS as a fully public service to end privatisation. So trade deals do two major things to public services if the services aren't comprehensively excluded. They lock in privatisation, as I've said, meaning that future governments will have a hard time undoing the damage done in the last few decades to our NHS, and for that matter, ending privatisation of rail or water or other essential services. And trade deals can push privatisation up a notch by requiring governments to increase market access steadily in a bid to liberalise global trade. And that's not even to mention pharmaceuticals. Other organisations know much more about this and are working on this directly, but the US has been clear in its intentions to pressure the UK to pay more for drugs to increase the strength of intellectual property protections so that patents last longer. And that means drugs are more expensive, not just for the NHS, but for other healthcare systems who currently enjoy lower prices because of the NHS's ability to bargain those prices down. So if the trade bill is not amended, as Emily Thornberry brightly said in her article for The Guardian yesterday, then all that stands between our NHS and Donald Trump are the promises of Boris Johnson and the negotiating skills of Liz Truss. It doesn't fill me with confidence. I don't know about you. And that's why we've spent the last 9 minutes campaigning to amend the trade bill to protect the NHS. Over 1 million people have petitioned the government. Thousands of people have emailed, written to, and met with their MPs over Zoom or on the phone. And recently, over 500 senior health professionals wrote to all MPs. And yet, on Monday, despite all of this, the Conservative Party walked through the lobbies of the House of Commons to vote against an amendment to the trade bill that would have protected our NHS from trade deals. Despite all of Boris Johnson's warm words and platitudes, all the times he claimed the NHS would never be up for sale, all those times he stepped outside the door of 10 Downing Street and clapped for the cameras. Tory MPs repeat that they have no intention of selling off our NHS. They point to their manifesto promises that the NHS will not be on the table. But as we know, their manifesto is not a legally binding commitment. Red lines in the trade bill would give us the reassurances that we need that the NHS is safe, and yet they refuse to put them in. And the only reason I can think of that they refuse is because they want to keep their options open to offer up profitable chunks of our health service to private companies. And at a time when we're relying on our health service more than ever, that is a huge betrayal. To make matters worse, Tories also saw fit to vote against giving Parliament the right to properly scrutinise future trade deals. So that means the government can negotiate, agree and sign up to trade arrangements behind closed doors without MPs getting to scrutinise or vote on them. It's really anti-democratic. I mean, they talk about taking back control. Apart from the handful of Tory MPs who defied the whip and voted in favour of this scrutiny amendment, the whole party have just spinelessly given up their own powers to hold the government to account, just to please the front bench, who would rather not be held to account by their own MPs. And then these backbench Tories have the cheek to make videos explaining to us, don't worry, I'd never vote for a trade deal that sold off the NHS. Well, no, they won't get a chance to. The government can force that through against the wishes of Parliament if it wants. But all is not lost. And I want to echo what Jeremy said, it's not too late to save the NHS. While the trade bill has passed through the House of Commons, it hasn't been signed into law. So first it's got to go through the House of Lords. The Tories might have an 80-seat majority in the House of Commons, but they do not have a majority in the Lords. And so we're relying on the Lords now to amend the trade bill, whether they're Labour, Green, Lib Dems, crossbenchers, hopefully even a couple of Tories, to stand up and to resist the trade bill and protect our NHS. We launched a petition yesterday afternoon aimed at the House of Lords, and within 24 hours, 80,000 people had signed it. It's now well past 100,000 people and still growing really fast. So the momentum for this campaign is only growing, and people's anger and outrage at the actions of Tory MPs on Monday is just fueling this really strong campaign to make sure that our NHS is protected. And even if that doesn't work, if the trade bill is not amended, I have every faith that the people of this country won't sit down and allow our NHS to be sold off. We're going to resist trade deals one by one if we have to, whatever it takes to keep the NHS in our hands. I'll finish there. Thanks.
Ellen, thanks so much for that very, very thorough assessment. And I'm finding it a bit difficult actually to understand the scale of the threat to our NHS, and this is why this is so important. And I'm going to move on to John in just a second, but I mean, you're absolutely right. What do we do as the people of the United Kingdom when, on the one hand, we have those in power who are saying the very opposite of their actions? So we are not privatising the NHS. We won't allow that to happen. And yet, when there are safeguards put in place, they reject those safeguards. And I agree with your analysis, because they need that. They need that huge kind of network of resources, essentially, to be leveraged in a trade deal, which is an unbelievably difficult situation to be in. So you're right, never mind take back control. This is a power grab by the most powerful, some of the most powerful people in our country, and certainly isn't given any power, or it is kind of taken power away from people to be able to influence that. And I suppose I just want to ask you, before I do come to John, Ellen, like, do you think this is kind of the most serious threat that the NHS has faced?
That's hard to say. I mean, I've been involved in NHS campaigning only really for the last couple of years. And I know that privatisation has been going on, it's been sort of steadily creeping for a couple of decades at least now. So I don't think it's easy to kind of pinpoint one threat that the NHS faces. It's, you know, as long as there are people in the world who want to make profit from people's healthcare, we're going to have to be defending our NHS. So this is a long game, but I know we're all up for it.
And let's now then come to John Lister. He's of the Health Campaigns Together. I know, John, you have been campaigning for our health service for a long time. Thank you so much for everything you've done, and we'd just like to hear what you think right now.
Thank you, Laura, and thank you, Ellen, for a really interesting exposition of the issues on the trade bill. I'll briefly touch on that, but I'm mainly going to look at the background of privatisation and how we got to where we are. The Tories argue that free access to treatment for most people proves that the NHS is not privatised. But by this same argument, of course, opticians and much dental care, which were free of charge in 1948, and the social care for many frail older people who formerly would have been the responsibility of the NHS, but now have to pay means-tested charges, have been privatised. But privatisation goes a lot further, because we've got a growing share of the 130 billion NHS budget is not going not to NHS bodies, but to private companies. We've been taking over contracts for work that was previously done by the NHS. And that's what I mean by privatisation. And there's lots of it, and it's getting worse. And the rot of privatisation started under Thatcher in 1984. Hospital management were forced to put so-called hotel services, which is a strange phrase, hotel services, cleaning, catering, laundry, and later portering, security and maintenance, out to competitive tender. Privatisation of cleaning became a byword for poor quality services, a catastrophic fall in levels of hygiene, and proliferation of hospital-borne infections such as MRSA. 35 years later, support staff in 40% of trusts are still 40% of trusts are still using contractors who give their staff inadequate sick pay, a grim legacy of Thatcherism. The Tories claimed they wanted efficiency and value for money, but the key for them then, as now, was siphoning out NHS funds into the pockets of their friends and donors, the private contractors. Thatcher went on to create an internal market that separated purchasers from providers and forced hospitals to compete with each other for contracts. But it was Tony Blair's government that went further and started the process of offering up clinical services to private contractors. New Labour built new hospitals through the ruinously expensive PFI, which Jeremy mentioned earlier, with payments running in for some until 2048. Much of that money now flowing offshore to tax havens. Egged on at the same time by Simon Stevens, who was then an advisor, but now of course is boss of NHS England. From 2000 onwards, New Labour went even further, and for the first time, they opened up clinical care to private providers. Waiting list patients were sent to private hospitals for operations at costs up to 40% higher than NHS hospitals. Hospital corporations were brought in from abroad to set up independent sector treatment centres and given contracts to deliver uncomplicated elective operations at prices averaging 12% above the NHS going rate. From 2005 onwards, New Labour and NHS bosses started to talk about partnership with the private sector, with complete separation of commissioners from providers, and even urging commissioners to open up contracts to any willing provider for clinical care. All this laid the basis from 2010 for Andrew Lansley as the Tory Health Secretary to push through the disastrous Health and Social Care Act, backed of course by the Liberal Democrats. This brought the privatisation hand in hand with the brutal austerity squeezing the NHS and public sector. The Act established clinical commissioning groups as the budget holders that we have today, and regulations that compelled them to put an ever wider range of clinical services out to tender. Since 2015, more than 75% of CCG contracts awarded for pharmacy, patient transport and diagnostic services have gone to private companies, along with almost half of community health services contracts and 25% of mental health contracts. Privatisation is now the most extensive in mental health. We've got 44% of NHS spending on child and adolescent mental health goes to private providers. 97% of the market for locked ward rehabilitation was held by private companies in 2015. The most recent figures prior to the COVID pandemic show that private providers held contracts for £9 billion of clinical services, 7.3% of the CCG's budget. On top of that, we need to add hidden privatisation. So there's another 1.1 billion of work outsourced by hard-pressed trusts to private hospitals. 2.8 billion going to privately delivered services funded through local government. Pharmacy contracts for Boots and Lloyds, etc., worth 1.9 billion a year, and contracts for Specsavers and others providing glasses, contact lenses and hearing aids. So the real total on private providers in 2018-19 was 18% of NHS England spending, equivalent to £23 billion a year. Since then, more contracts, notably for back office services, processing data, and online services like GP at Hand, have begun leaking valuable data and cash to private corporations, including some American companies. But the sharpest acceleration in privatisation has been in the last few months during the COVID pandemic. And Jeremy touched on this. Deloitte were brought in to manage drive-in testing centres, which they then subcontracted to Serco, G4S, Mighty and others, and a new network of super labs. All of this bypassed existing public sector facilities and expertise and produced a much poorer, dysfunctional system than they would have produced. Serco was given the contract for a spectacularly ineffective tracing programme, whose 25,000 staff are contacting less than one person per employee per fortnight, while 90% of the contacts are being traced by public health experts. Faculty and American company Palantir were gifted contracts to build the COVID-19 data store, giving them access to potentially priceless NHS data. Capita, with a long history of contract failures, has been entrusted with recruiting and supporting staff returning to the NHS. 8,000 beds in private hospitals were block booked at an estimated cost of £12,500 per bed per week to provide extra capacity, though few have been used because of lack of staff. Huge sums have been awarded in dodgy no competition contracts to companies, several with no staff, no assets and no experience to buy in PPE. Now the Daily Mail, even the Daily Mail is shocked to find the Treasury has released almost £32 billion since the pandemic hit to the NHS. £15 billion apparently for PPE, and goodness knows where most of that has gone. £5.5 billion to hire private hospitals, and a staggering £10 billion on what the Daily Mail calls bungled test and trace programmes. To make matters worse, McKinsey have now been brought in at ridiculous cost to sort out the test and tracing system, which is supposedly overseen by Baroness Harding, formerly of McKinsey. Since the mid-1980s, privatisation, a system to slice out private profit from the publicly funded NHS, has produced a long and growing list of contract failures, excess cost, reduced quality, fragmentation, loss of accountability, and weakened the NHS as a public service. So when Johnson & Co put the NHS firmly back on the table in the US trade talks and removed any accountability to Parliament for those talks, it's not that they're going to sell the NHS as such to American health corporations. because they don't actually want to buy it. They prefer to milk a vast public sector budget with minimum investment and minimum risk. But it will offer even more openings for them and others to move in on new contracts and carve out a larger slice of the NHS budget for the goods and services they do want to sell to us, bumping up prices for vital drugs and equipment, expanding their data services that allow them to profit from NHS data worth billions a year and then sell back to us apps and drugs that are based on that data. We still have an NHS that is publicly funded and mostly publicly provided. We still have something to lose, a lot to lose, if we let this go. That's why we need a maximum effort to roll back the trade deal, and we're working to bring together the broadest possible campaign around the rescue plan that's been drawn up by Keep Our NHS Public and Health campaigns together.
Wow. If anybody ever says to me again that the NHS isn't privatised or it's scaremongering, I'm going to play John's speech. I'm just going to go listen to John and listen to Ellen. I mean, it is an extremely serious set of circumstances you've just outlined there, John. Am I right in thinking, I was taking notes as you were speaking, that you said that 8,500 beds in the private sector were block booked as a reserve kind of bed space for the coronavirus crisis at a cost of 5.5 billion. So that's 5.5 billion pounds that is essentially being used on nothing other than shoring up the private health sector.
Yes, because a lot of those beds have not actually been used. In fact, they can't be used because there aren't enough staff. The underlying problem for the NHS in terms of expanding capacity is that we went into the pandemic, the COVID crisis, with 100,000 or so vacancies, including up to 40,000 nurses short, but also crucial people such as anaesthetists, for example, if you want to run surgical operations in these private hospitals, which aren't equipped to actually deal with COVID or ITU cases, but they could be used for elective surgery. But in order to do elective surgery, you need anaesthetists, and there aren't enough to go around. So you can either have the NHS working fully, or you can actually gear up the private sector beds to use, but you can't have both at the same time. And so it was always a complete folly, actually, the idea of booking these beds to expand NHS capacity, as indeed was the Nightingale hospitals that were built, one in London with 4,000 beds and only treated 54 patients. These are just ridiculous because they couldn't staff them without depleting the frontline services that were fighting COVID in the NHS elsewhere.
And you can just imagine what could have been done with 5.5 billion pounds. I mean, it's enough to make you weep. There are people hungry right now. There are people who are struggling on the measliest amounts on statutory sick pay. And that money has literally been given to probably what are already very wealthy shareholders. And, I just want to move to some of the questions that people have put in the comments. People have raised two key themes, really, and I do want to want you to try and help us answer them. The first one is the media. Jeremy mentioned it. There is just not an urgency in the mainstream media about this. I remember I was interviewed by one reporter when this leaked report came out, and the only line of questioning that they asked for was about where the report came from, not the contents of that report. And that's a pattern. We don't really see a forensic assessment of what John and you, Ellen, have just outlined. So where can people go for that information to teach themselves about what is happening? And secondly, loads of people, like Karen said, what does the panel think ordinary people can do to save our NHS? Many think that there's just nothing we can do because it seems like the Tories can do what they want. They've got a really, really big majority. The media seems complicit. Ellen, could you start by helping us answer that question or those questions?
Yeah, absolutely. So on the media question, that's a really tricky one. And obviously you can't as a campaign organisation, we're constantly trying to get campaigns into the press, and it's always a bit of a guessing game. And I suspect that a lot of the reluctance from some of the bigger outlets to talk about this is just the strength of the denial coming from the Conservatives about the trade deal issue specifically, but also privatisation in general. they don't want to look like they're spreading conspiracy theories or something that isn't, you know, proven to be true. And if you've got the party in power who are just shouting over and over again, the NHS is not on the table, it won't be sold off. It makes people nervous, you know, even quite sensible-ness. So I don't know the solution to that thoroughly. Obviously, we've got to make our arguments really, really clear. We've got to just keep reaching out to, you know, as many outlets as possible. And since our petition has really kicked off today, we've been contacted by quite a lot of not necessarily really mainstream outlets, but we've definitely got pieces in slightly smaller kind of online magazines. We've got the New European, I think the National as well as interested. So it's, you know, depending on it's always sort of up to the campaigner to make the story as interesting as possible, and make it so the journalist feels comfortable talking about that. And it's just a tricky thing to do with this sort of almost gaslighting that the Tories are performing on the British public, you know. In terms of what we can do to save the NHS, loads of things. So of course I'm going to plug the petition again. Please do sign that and share it with your friends. We'd love to get up to 200,000 signatures. The House of Lords are going to look at the trade bill in the autumn, and between now and then we're going to be making ourselves known to them. We're going to be introducing ourselves, starting to talk to them about these issues, and so if you want to get involved in that work, sign up to We Own It, and we'll have ways that you can get involved in that as well. We're sort of developing the campaign strategy at the moment. And the last few months I've been training people up to have meetings with their MPs, so rather than just writing an email, people have been sort of learning how to have face-to-face lobby meetings, albeit over Zoom or Skype. And I'd love to do more of that kind of work over the next few months and empower people to have proper conversations, whether that's with their MPs or other relevant people to the campaign. And Health Campaigns Together, as well as Keep Our NHS Public. There's so many other amazing health campaign organisations who are mobilised around the country, resisting the sell-offs of local hospitals, local A&E departments, as well as a sort of wider picture of privatisation. So get involved wherever you can, and if there isn't one in your town, start one up. I think this could be the summer of resistance for the NHS if we make the most of the opportunity.
Let's hope so, Ellen. And we have posted the petition on the comments. So if people watching this, and there are lots and lots of people watching this, if you could do two things, please share this live right now. And please, if after this program you've got some time, please copy and paste that petition to your own timeline, asking your friends and followers to also share and sign that petition. Our networks, if only we knew it, our networks are so huge. We are so powerful as a movement. We can get that survey to 500,000. Come on, that's our challenge. John, could you answer those two questions? How do you get involved? Like, you know, how do we kind of re-educate ourselves on what's happening? What do you say to that?
Well, firstly, I'm going to plug the fortnightly online news bulletin that we produce called The Lowdown. It's free to access. It's lowdownNHS.info, and or just Google the Lowdown and it'll come up. And that gives the best up-to-date information that we can produce from as a small group of specialist journalists following these things and trying to explain it for campaigners. So that's one thing. Health Campaigns Together website. We have a listing of useful information under Fighting the Coronavirus, I think it's called. And it's just basically links to articles from all around the world looking at useful aspects of what's going on in terms of the fight against coronavirus, but also the fight to keep public health and public health systems intact. And I just wanted to really flag up, I know that it's easy to feel a bit defeated and daunted by this, but it's also important that we realise the Tories can't just do what they like. They got elected on the basis of the fact they were selling themselves as big supporters of the NHS. And of course, large proportions of particularly their older voters really depend on the NHS. So if you get a situation where, it was an astonishing contradiction that you wound up with an increased Tory vote in areas where you've got large numbers of older Tories on trolleys in hospitals winter after winter because of the austerity policies that cut back the NHS, and people still go out and vote vote Tory. So one thing is to start to draw those contradictions out. And certainly I think there are things. I mean, we saw, for example, on the pressure on health workers having to pay the immigration health surcharge. There's been other things in which even Tory backbenchers have been forced to come out and actually take a position which actually contradicts the government position and force a change from the government. And I think if we play our cards right on this, there are aspects of this situation we can use to further divide. I mean, the key is to actually recognise this government got elected on a majority of 80. So unless we actually are going to just be incredibly self-restrained and hang on for 5 years, then we have to find ways of splitting that 80, which means we have to reach out to win some Tories to actually support what we're saying. We have to try and put our arguments in such a way that they can actually understand we're not just raising here ideological points because we hate the Tories, although some of us, many of us actually do. But we're actually trying to actually get a point across that there's a tangible service that's facing a real risk as a result of policies the government they support is going forward. And we have to try and split off sections of the Tories. We have to try and split some backbenchers to actually make an impact on the government. And we have to see that as part of what we do. And when we draw up the rescue plan, it's written from that point of view. It's written to actually put all the key points, but to put them in ways that we can actually explain on a broader non-party political basis to try to reach out as widely as we possibly can. We know most of the people who are instinctively on the left will support what we're saying. So we don't necessarily have to win them. We do have to win people who don't otherwise support us. And we have to make a really big coalition. And it's great to have been able to work with People's Assembly, with We Own It, and with other colleagues in building the NHS birthday events, Keep Our NHS Public, and so on, which were extremely successful. We had tens of thousands of views for the events across that weekend on social media. And we are lucky to have that opportunity to reach out to large audiences. We've got to do more of that into the autumn around the rescue plan that we've drawn up, which is available on the Keep Our NHS Public and Health Campaigns Together websites. And we hope that people will help us to work with that, develop further on it as we need to, but actually use that as a basis to actually build a really broad, powerful campaign. We're not defeated yet, and we've got too much to lose to give up now. Let's not start looking at how much they've won and how strong they are. Let's start looking at how strong we can be and what we can actually do to actually fight for what we believe to be absolutely basic.
John, you make some absolutely brilliant points there. I mean, defeatism is not going to save one single piece of paper in the NHS, never mind the fundamental services that we love and that serve us. And I think it is also right to think politically about this. Like, how do we win in any campaign? And I'm sure Ellen thinks about this and John thinks about this all of the time in their campaign and work. Of course, we want to win more working class people to our campaigns through logic, through reason, through having those debates, through having those arguments, not in a judgmental way that says, oh, how come you don't know this by now? Or, you ought to stop reading whatever you read. That might be a feeling that you have, but really we are trying to win people to join our struggle to save the NHS, to bring about a different economic system, to end austerity and make sure working people do not pay for the coronavirus crisis. So it is incumbent on all of us, isn't it, to kind of step outside sometimes those spaces where we're talking to people who agree with us and actually engage with people who viscerally disagree. And I think that I am noticing, and I'm going to bring you in a second, Ellen, I'm noticing a change actually on lots of local groups that are usually not very political, or if they are political, aren't necessarily very friendly to left ideas. There was outrage about the rejection of the amendments that protected the NHS from the trade bill. And we have to tap into that. Not that we were right and you should have listened to us, but this is what they will do. Ideologically, if you believe in a free market, then the free market is free. It's free to go anywhere it wants. There are no boundaries to those people who believe a capitalist system should be able to enter any aspect of society, including healthcare. Nothing is out of bounds for those people who are ideologically driven like that. And why isn't it a healthy thing? Because we have talked about this before on this program, and I would love it if you could say in your words, why not have private companies delivering elements of the National Health Service? If your beloved grandma gets the operation she needs, why does it matter who delivers that service? I would love to hear what you say back to people who ask that question. Ellen?
Yeah, it's a really good question. So there's the moral argument that services that are that essential should not be provided for profit, no matter what, because as soon as you introduce profit to the equation, people get, subsumed to that goal. I saw a great tweet in an American context. I can't remember who it was from, but they just listed healthcare, prisons, education. These are 3 things that should never be provided for profit by profit-making companies, and they correspond exactly in an American situation to life, liberty, and the pursuit of happiness. And I think you could probably translate that to the UK as well, because they're, ideals that a lot of people would follow as well, like things like healthcare that are just so essential. We've fought for the right to have free universal healthcare in this country. We built that ourselves. And introducing profit is just, it goes against the grain of the principle of free universal healthcare. They can't exist at the same time.
Very.
And if I can, if you're,
yeah, of course.
the bit about new people getting involved in this campaign and talking about the NHS who maybe weren't political before, I've definitely seen evidence of that over the last few days. We've had on Instagram in particular, we've had hundreds and thousands of shares from people who don't usually post about anything political, just scanning through the list. And if you want to cheer yourself up, go and watch the videos that a couple of Tory backbenchers posted today to try and deny that the Tories are selling off the NHS. I think it was Deanna Davison and Anthony Higginbottom. And if you just read the comments underneath those videos on Twitter, every single one of them is an intelligent, articulate person asking very sensible questions about why they didn't just vote for the amendment if they don't intend to sell off the NHS anyway. What's the problem with putting that into the law, And there's people from all walks of life are just not buying that message at all and are asking all the right questions. So that cheered me up today.
It would take some stretch of the imagination to be able to believe people wriggling out of that one. John?
On the question of why not the private sector, I mean, firstly, if you look at the privatisation I've been talking about when I was in my talk, it fragments services. Okay, you have a lack of accountability for private contractors. Who see themselves only as accountable to the contract and not to the actual quality of care that they deliver, and will look at every possibility of evading that contract. So you wind up with poorer services, insofar as you ever save any money, it's short-sighted because it's at the expense of the quality of care. And often these savings are also at the expense of the quality of the pay and conditions of staff, which means you wind up with casualised staff. It means, again, as we've seen with COVID, with contract staff being under pressure to come in and work despite being ill during a pandemic, which is the worst possible scenario. All of that is linked together with the idea that these contractors are somehow outside. And of course, for the staff themselves, they feel and are left outside of the NHS as a team, as a workforce. So you wind up with a less efficient workplace team, because you've got certain sections of staff are not under the same management and are not able to be part of that arrangement. And of course, the whole question about the quality of care that you actually get in private hospitals, which are geared up for a very limited cohort of patients. They basically only want to do operations on people who aren't ill and just need one simple operation done. And they will come in and go out on a predictable basis. And that's the way that private hospitals are geared up. They don't have any accident services, they don't have any emergency services, and they don't train any staff. These are just completely parasitic bodies that pick up on these aspects of care. They take those services insofar as they grow, and they take NHS funding to deliver those services. The money is drained from the NHS trusts, which are then not able to invest in care and in the multidisciplinary teams and all of the things which are distinctive to the NHS. So I think overall, in every way, you can see the NHS being undermined by the use of private providers and not strengthened. And so it's not simply, or at all actually, in the way I would see it, an ideological question. This is actually a straightforward practical question. If you want to develop a comprehensive healthcare service, which is what the NHS grew as and is supposed to be, then you need to keep it as a single service, and you need to resource it to deliver all that's needed, rather than relying on, for example, private hospital beds to fill in gaps, because otherwise you're fragmenting that service, you're undermining it, and you're creating possibilities that it will be less efficient and less effective in caring for patients. Can I just mention very briefly, in terms of the media, don't forget, even the Daily Mail, even the Daily Telegraph are getting really impatient with some of these visible Tory screw-ups on privatisation. They are getting, the fact that the Mail talks about the botched test and trace system, the bungled test and trace system. The Telegraph has run major articles slamming the way the government has handled the COVID crisis. It's not a given that because we got a Tory media, they're not interested in stories showing that the Tories are getting things wrong, because they've got an audience of people who care about these things, because quite often they're people requiring to use those services. And that news audience, if we can package the information in the right way and not make it look like it's political point scoring, we can sometimes get those stories into those sections of the media as well. And that's where it really makes a difference. It really hurts the Tories. So we've got to try and do that as best we can as well. And I'm sounding like the old right winger here, but I'll tell you what, it really can make a difference. If we can actually really start to hurt those Tories, get stories into those key papers that reinforce the Tory view, then we can start to really do some damage to them. And that's what we've got to try and do over the next few months.
So you've heard both the moralistic and the very kind of practical, and I suppose the practical case for why privatisation is bad, why it should be resisted, why we should make sure that, whilst clapping, and the reason this programme ends at 8 or just after is so that we once went out and joined in with the clapping to show our gratitude, but we definitely know now that the NHS needs defending. We know that the staff within it need us to stand up and, kind of put our gratitude into action for those people. Jackie Gilderdale raises a very, very interesting point. She said that the health sector is the biggest employer in the United States. It will be always on the table and on the agenda for Trump. And she finishes by saying, Jeremy Corbyn, you told so many truths and so many didn't listen. And I suppose it's our job now, in the kind of most loving but passionate and determined way, to make as many people as possible listen to the truth that Ellen and John brought us and the groups that they represent. They need your support to get this truth out there. This is not about gaining a majority on a political party. This is about changing a whole cultural framework in this nation, where we say we are calling time on an era of mass and rabid privatisation, because look what it has done. So anybody that continues to support that kind of system will be punished at the ballot box, or we will go out and protest against their ideologies and ideas. We'll sign the petitions, we'll go on to the picket lines with staff, we will take action and put that gratitude, as I said, into action over the summer and beyond. So solidarity to Health Campaign Together, and to We Own It, and to Jeremy Corbyn. Thank you so much for your contributions this evening. Don't forget, you can still share this programme. I'm like a blinking broken record. You can still share this programme so that people who haven't seen this will see it. Even tag somebody in, I say it quite often, but tag somebody in who disagrees with you, who thinks you are talking nonsense. Tag them in so they can hear what John, Ellen and Jeremy has said. We are now going to take a break in this series over the summer. Please let us know what you would like to see from the People's Assembly. Lots of people have said that they really enjoy the online content. It's super accessible. People are able to join in ways that they wouldn't have been able to otherwise. So we want to come back, but we want to come back with what you want and what you want to hear and the people that you want to listen to. Don't forget, Saturday there is an important meeting at 1 p.m. from the same place, the People's Assembly, channels on jobs, industry and the future of work. Solidarity to every single person. Thank you so much personally for all the comments that you've given about what this provides us every week and has done for the last 20 weeks. And a massive thank you. You don't see them, but honestly, there are people behind the scenes who make this program happen. They generate the graphics, they book the guests, they make sure that we can live broadcast to thousands of people. So